Hi, this is Dr. Andrea Furlan. I am a pain specialist in a pain clinic, and today we are going to talk about complex regional pain syndrome, or CRPS. Usually when people are referred to me, they wait many months for the initial appointment, but when I see the referral that says this patient may have CRPS, I usually book that patient right away because we can't delay treatment for people who have CRPS. So let's talk about it today. So what is CRPS? CRPS is a type of pain that is very severe. It has some signs and symptoms that are very characteristic of CRPS. Presentation of CRPS is usually pain in one of the limbs, upper limbs, arms and hands, or lower limbs, knees, below the knees, ankles and feet. It usually affects only one limb. It's only one arm, only one foot. Rarely it affects more than one limb. The initial presentation of CRPS is usually after a fracture or a surgery, some trauma that happened to that limb, but may not be related to any trauma. People who had a stroke, they may have CRPS in the site affected by the stroke. People who had a brain injury, or even people who had a heart attack, they may have signs of CRPS in one of the limbs, usually the left arm. But it also affects people who didn't have any trauma. So some people will have no recollection of anything that happened to them. They will still have the symptoms and signs of CRPS. The symptoms of CRPS are very characteristic. So first of all, there is a very severe pain. It's a type of pain that is so excruciating, and it's not related to the amount of injury that happened to that limb. This pain is also it's constant pain. It has some characteristics of neuropathic pain, such as tingling, numbness, burning, electrical shocks. The person is also very sensitive to touch. We call this allodynia or hyperesthesia. So this pain that happens in one limb, it also comes with other symptoms such as hypersensitivity, swelling of the extremity, can also have some change in color of that limb, can also have change in temperature, change in the sweating, how the skin sweats, also changes in the hair of the skin, and also how the nails grow. The person will notice there is weakness in the side affected by CRPS. There might be some tremors on the side affected by CRPS. So those are the signs and symptoms that we observe when we suspected someone had CRPS. So what are the causes of CRPS? We actually don't know what causes CRPS, but we know from recent research, especially with brain imaging, we know that there is an abnormal pain processing in the brain. We call this central sensitization. There is also peripheral sensitization, which means that the nerves and the receptors that carry pain to the brain, they're also more sensitive. I explained this process of central sensitization in another video that I made, and I explained that the pain system is like the alarm system of our body, and hence the alarm system of a house can also malfunction. Our pain system can also malfunction, and CRPS seems to be a malfunctioning of this pain system. So we need to find ways of fixing the pain system to help people who have CRPS. And because the pain system is sensitized in the person that has CRPS, other areas are also sensitized, such as the areas that control sleep, anxiety, mood, and concentration. There is a type of CRPS that is called CRPS type 2. And in this case, the person will have a traumatic nerve injury. There is a neuropathy or a problem with one of the nerves, and that can explain some of the symptoms. So when we make the diagnosis of CRPS, we need to make sure that we exclude any other diseases or conditions that could be causing this severe pain and the swelling and the changing colors and changing temperature. Things that we need to think about are, for example, a blood clot or an infection of the skin or infection around the bones. Also some metabolic diseases like a decompensated diabetes. Could also be some systemic problems that are causing this swelling. So we need to make that exclusion before we say this is CRPS. So how do we make the diagnosis of CRPS? There is not a lot of laboratory tests or imaging tests that we can do to say this is CRPS or this is not CRPS. None of the tests will be 100% sure. But we have to order some tests to exclude other things that could be causing those symptoms and they are not CRPS. But also, in some cases, we can order an MRI of the affected area and also a bone scintigraphy. This is the injection of some radioactive material. It's called bone scan. And those tests can show some signs, some differences and changes in the results of those tests that are suggestive of CRPS. But of course, those tests will be more positive if we order them in the early stages of CRPS. If it has been too many months or years after the CRPS has started, we'll probably not see those changes in those tests. Sometimes we also order electromyography and nerve conduction studies, and these are because we want to see if this is not a CRPS type 2, where there is a nerve damage or nerve injury. And how do we treat CRPS? Well, first, the most important thing is the sooner we start treatment, the better will be the results. Ideally, a person with CRPS should be seen by a multidisciplinary pain team. That means that they will see different professions, including physicians. I am a physiatrist and I can handle medications, I can help them with manual therapies, I can indicate some nerve blocks and procedures. They can also be seen by anesthetists, psychiatrists, neurologists, and they also need to see other professions that are not physicians. They need to see physiotherapists, occupational therapists, and psychologists. Unfortunately, it's frustrating because not a lot of people have access to multidisciplinary pain teams, or if they have a pain clinic close to where they live, sometimes they will wait months or even years to see a multidisciplinary pain team. In terms of medications, we give preference to anti-inflammatories. We can give non-steroidal or steroidal anti-inflammatories. We can also give medications that regulate calcium, because calcium is very affected in the bones of people with CRPS, and those are the same medications that usually people use for osteoporosis. We also tend to give medications that will help to regulate the pain system, and those are the antidepressants, the tricyclic antidepressants or the SNRI antidepressants. We can also give the gabapentinoids like gabapentin and pregabalin. We can also give medications that will regulate the sodium channels. Those are things like lidocaine, and also NMDA blockers like ketamine. There are other medications that are used to treat the symptoms of CRPS. Because the pain is so severe, sometimes we need to give them opioids, ideally for a short period of time, so then they don't develop tolerance to the opioids. We can also use some topical creams. This can be topical creams containing lidocaine or amitriptyline or even anti-inflammatories if the area that they have to apply is not too large. But it's also very important that they include physiotherapy or physical modalities and movement therapy to treat patients with CRPS. The modalities that people use in physiotherapy are usually desensitization, mirror therapy, aquatic therapy. Usually it's very good when a person has CRPS of the ankle and foot because they can't put weight. Every time that they put weight on that area, it hurts a lot. So doing exercises in a pool is very helpful. Also, they can do what we call graded motor imagery and also therapeutic exercises. It's also important to remember to do psychotherapy. People with CRPS, they will have those areas of the brain that control the fear, emotions, and mood affected. So these people will benefit a lot by doing relaxation exercises, cognitive behavior therapy, biofeedback, breathing, deep breathing exercises. And in some cases, they will also benefit from nerve blocks and some intravenous injections. The nerve blocks that have been somehow helpful for people is especially on those cases that they have swelling and disturbance in the temperature and change in color, because those are what we call autonomic symptoms. So blocking the autonomic nerve system is very helpful, and we may recommend them to do some sympathetic nerve blocks. And last, when the person has tried everything for pain and they still have very severe debilitating pain, we recommend neuromodulation, and in this class we have spinal cord stimulators. Spinal cord stimulators are implantable devices that will give continuous electrical shocks in the spinal cord to block the pain sensations. A lot of people ask me, can we prevent CRPS? Can we avoid this from happening? How do I know if I will develop CRPS, and can I do something about it? Unfortunately, there's not much that we can do. We know that there are high-risk groups, such as older people who have a osteoporosis and then they have a radial fracture, which is this bone here. They are more prone to have CRPS after they fix the fracture. However, in other cases, we don't know exactly how to prevent. There has been some suggestion that vitamin C can prevent a person from developing CRPS. So in any orthopedic surgery or after a fracture, a person could be taking 500 milligrams of vitamin C for about 2 months, and that may prevent them from developing CRPS in the future. However, early treatment is the best prevention for further complications. And please remember that this video is not intended to provide individual patients advice, but it's only to provide education. If you think that you have a condition that is causing you CRPS or complex regional pain syndrome, please consult a physician to get a diagnosis and a treatment plan for you. If you like this video, don't forget to like it. You can also subscribe to this channel and be alerted when I post more videos if you turn on the notifications. You can also leave comments, questions, suggestions for future topics. You can leave it here, but I also tweet. I have a Facebook page and an Instagram account if you want to contact me there. Thank you very much. Bye for now.